is your pelvic floor relaxation video. It is something to indulge yourself with for many different reasons. Often we know early postnatal that your pelvic floor can be a bit tense, and there's reasons for that. Sometimes there's been injury or a perineal tear to the area, and sometimes birth, you can remember it and feel it as a traumatizing experience, and your pelvic floor is not ready to get over it yet. So pelvic floor relaxation can be really helpful to slowly ease that muscle back into its resting length. It can also be really helpful if you're someone who's struggling with difficulty voiding, so either difficulty starting the flow of your pee or any kind of constipation issues. And also if you're wanting to get back into sexual activity and maybe you're not totally sure about it yet, or you've tried and things are just feeling too tight for your pelvic floor to actually relax and accommodate. So we're going to go through a few different movements. There's no pelvic floor contractions in this video because we really just want to bring the focus to the opposite end of that range of motion, that length. I have a pillow here because I'm going to be doing a child's pose, and I like putting a pillow underneath my hips, and know that like all the pillows are better for support, whatever makes you feel more comfortable. Ease in and out of the depth of the position to adjust it to whatever fits with your body and how your body parts are feeling, right? There's no right way to do this. So let's get started. First, we're gonna do a wide-legged child's pose. So I'm gonna come and go sideways. I would encourage you to place something behind your bum, or if you're comfortable in your child's pose position with your bum on your heels, whatever. And then come on down to the ground. I'm gonna put my hands on my forehead. Usually I would be like totally face down, but for audibility, I'm just gonna keep myself upright a bit so that I can cue you on what you should be doing here. So let's just take a few breaths to kind of like settle in, see where we're at and what we need. So I want you to take a nice breath in, thinking about breathing down into your trunk, letting your belly, your low back inflate. Open your mouth, soften your jaw, and just sigh that breath out. Do that again, and notice if you feel anything in your pelvic floor as you breathe in, as that diaphragm expands and lengthens your low back. Naturally, the pelvic floor is also lengthening. And as you breathe out, when you think about releasing your jaw, softening your shoulders, what happens in your hips? We're going to be spending about 4 to 5 breaths in each position, and I just want you to take that visual and almost like allow that muscle to soften a little bit more. And it's not just the pelvic floor, it's the hips and your neck and your shoulders and your jaw, really anything. So inhale, think about widening through the sit bones, breathing space into the lower part of your trunk. As you exhale, just see if you can melt into that position a little bit more, letting something else go. For me, I'm imagining you're going to inhale here. I imagine my openings in my pelvic floor as little circles, and as I breathe in, the circles get wider, and as I breathe out, I'm just trying to like soften the circle, so nothing's tightening again. I'm just kind of like letting it sit there. Last one here. Think really subtle. Like it's not as if you're gonna feel this wave of relief, but it can be nice that like you're starting a bit contracted and you didn't notice, and then the more that you spend time in these positions, the more you realize that like, oh yeah, this does get a little bit more relaxed. So now we're gonna go into a tabletop position, and we're gonna do some tabletop rocks, but thinking about widening the space between your butt cheeks. Okay, so as you breathe in, I want you to inhale and hinge your bum back, widening through the sit bones, making your bum real big as you come back, and then coming back forwards. The breath here, you can exhale as you go back, or you can inhale. I like the inhale because it's like you're moving with the expansion. And you could hang out here as you exhale as a way to kind of counteract the natural like kind of drawing in of the pelvic floor on your exhale. You're really trying to encourage length. So inhale back. Let's go exhale, stay. Notice I'm not going down to my heels because the moment I start to do that, my pelvis tucks under and my pelvic floor kind of feels like it's shortening again. Check in on your stomach here. I just noticed mine was pretty grippy. So as you hinge back, take a breath in. As you exhale, can you let your tummy go? Just like let it hang out. How does that feel in your pelvic floor? There's a huge relationship between pelvic floor and lower belly tension or just gripping in your stomach. Good. So we're gonna try an inner thigh stretch. If this isn't comfortable for you, just skip it and do the next one. It can be pretty intense, but also just getting into this position and staying here might be a great place to start. So your inner thighs muscles attach up into your pelvis and they are related to the tension sometimes in your pelvic floor. So you can do the same kind of rock backs here or just hang out and think, okay, how much more can I let go around my inner thigh, around my pelvic floor. You're going to use 3 breaths on one side. So take a nice breath into your low back, visualizing those sit bones widening. And as you exhale, picture like ice melting, like just that softness, that just slow change in state. Breathe in. Let it go. If you're having trouble on your wrists here, you can always come down to your elbows. I'm gonna rock back for this last one until I get to that edge of discomfort and I'm like, okay, here, can I let go a little bit more? And let's switch sides. The body, my pillow's getting in my way. So switch legs, and we'll do 3 on this leg. And of course, you can always just pause and keep going if you're absolutely loving it. I just want to show you a few options in this 10-minute video. And your body's initial instinctive response when you get to the edge of discomfort is like contract and protect. So this is where we go to the edge and we hold it there and we inform our nervous system that like, I'm not in threat here. I'm using my breath as a way to reassure my body that like, we're okay. Your exhale is very soothing, very reassuring, very soft. What we don't want is for you to be unable to relax and almost like unable to breathe properly, because that means your body's feeling too threatened to actually let go here. So ease off of that position. It's always a great way to tell, you know, are you in your comfort zone or out of it? Okay, one last nice breath in. Exhale, let it go. Nice. Even sometimes, like, I was just talking, so obviously not very embodied, but having at the end of my exhale, I just felt those muscles kind of release just a little bit, which is great. Okay, come on onto your back, and we're gonna start with a little glute stretch / piriformis stretch, because we know that it's not just the pelvic floor, it's any muscles that are attaching up into the pelvis. So I want you to bring your left knee in towards your chest and grab your knee with your left hand. And then grab your grab your left ankle with your right hand. And it's as if you're trying to bring that heel to your right hip. And then the knee is kind of coming to your mid-chest. This is like a reverse pigeon. But everyone's a bit different. So some people need their knee to be pushed up a bit. Some people need to have their knee closer, ankle closer, just play around. You want to feel it along a band, along like the middle of your butt from your hip and like kind of straight back. And sometimes I like to grab it from the bottom here. And again, then we're going right back to the pelvic floor. So breathing all the way down to the trunk, letting that diaphragm expand, pelvic floor lengthen. And then exhale, soften, let it go. Inhale. If that twist in the knee doesn't feel good, you can always just hold on to just the knee in towards your chest is also good. It'll stretch for the back of the glute. The piriformis wraps from the hip and it attaches onto that tailbone. So it's really common that it's like pulling tight. And And sometimes there's a lot of lingering tailbone pain postnatal. Do one last one and see, okay, you're kind of honing in on where the sensation is. Can you let it go a bit more? Nice, and let's try the other side. Oh. One side might feel different than the other. Mine definitely does. And I just visualized my tailbone like lengthening towards the ground, kind of like uncurling. And then I really just like let my butthole go. So like imagine you're letting that fart out. We tend to hold so much tension, either like conditioned because we were taught not to fart in public, and so many other bad habits that I think we're unconsciously doing. Let that all go. One last breath here. Okay. Now, last one I want to do is a happy baby. If that is a triggering position to be in, you don't have to go on the full thing. Maybe just being here with your knees in your chest is right for you. Otherwise, you can start to slowly bring your knees apart and just hold onto your knees towards your chest. If that's feeling pretty good, you can go into the full position of like either holding your ankles or holding your feet. I'm gonna go for this one, and we're kind of targeting, like think of this being your inner thigh stretch, your pelvic floor length, your happy baby, your child's pose. And now we're connecting all the dots, really letting gravity just kind of like pull your body towards the floor. So thinking your breath goes down to your low back, widening through your sit bones, uncurling that tailbone. And as you exhale, can you soften your belly? Let go of that stomach tension, let go of your hips, shoulders, jaw. 2 more like that. Let it go. Hip flexors, thighs. Last one. Nice. All right, come on back up to sitting. That last position can definitely be a reminder of a very significant event of your life. So if that brought up a little bit for you, maybe take a moment to just kind of sit with that, notice what that is. And it's not a position to stay away from, but it's not a position to force yourself into either. So find that version that feels safe in your body, and it will continue to progress so long as you're not forcing it onto yourself. I hope that feels good. Do it all the time. Even when you just need a moment to yourself. Obviously it's very calming to take some breaths and just hang out, but bringing your attention to your pelvic floor and consciously just like listening and releasing can be really soothing and healing for many reasons. So that's it for now.